Okay, now I want to talk about a few time critical conditions where you have to act upon very quickly. These can be the surgical conditions or the medical conditions. Let's talk about the surgical conditions. The surgical conditions are those where the patient does not have much time to wait, like in case of acute limb ischemia. There is a surgical condition where you have to uh, work very quickly, otherwise, a patient may end up losing their leg. So, surgical conditions, acute limb ischemia is one of them. Then, acute hydrocephalus, then testicular torsion, tension pneumothorax. These are the acute surgical conditions, time critical, where if you delay, the patient may end up losing their life or limb. Apart from that, a few other conditions that can be time critical in case of surgery are related to the abdomen, like perforation, bowel obstruction, apart from that, any penetrating abdominal or the chest injuries, then splenic rupture. Apart from that, compartment syndrome. Okay, these are all the time critical conditions. What is the requirement of the time critical condition? Is first of all, quick assessment, keep the patient nil by mouth, IV fluids, and coagulation profile, uh, group and save, and refer the patient to the surgeons as soon as possible. Get all the urgent scans that may be helpful in delineating the anatomy and exact location where the problem is. They may be helpful, however, a careful assessment should be made whether or not the patient is stable. If the patient is unstable, then you do not need to bother about that, because the patient will need more kind of aggressive surgery and quick surgery. So all those things are very important. Always make sure that you discuss with your team and get their help. Do not just keep fighting alone on your own. It may be disastrous for the patient.